I will speak something that is my favorite topic. It's something about non-pharmacological measures to treat diabetes. And it is a common knowledge that the treatment of diabetes is not just a insulin treatment or oral anti-hyperglycemic agents, but also education for lifestyle changes, as it is nutrition and physical activity. So these are the subjects that we are not speaking a lot about it, and that's why today we will focus just on physical activity. It is a simple things that we can do for the patients in order to improve their metabolic control and outcome of diabetes. How can we simply prescribe the physical activity to our patient, because it is really one of the best medicine for patients with diabetes. So the prescription is very easy, how to be fit, or we should prescribe the frequency. We will speak about later on. It should be 3 to 5 days per week, then intensity, then time, and then type of physical activity. So we will start with the first, okay. We will start with the type of physical activity, or what types of exercises we can offer to our patients. So the first is the aerobic exercise, then resistance exercise. These are the two of the most prescribed types of physical activity, then flexibility exercise and balance exercise. First, what are the benefits of aerobic exercise? It was confirmed until now that in type 1 and type 2 diabetes, they can lower the risk of cardiovascular and overall mortality in patients with diabetes, type 1 and 2. And for type 2 diabetes, it was shown that this type of activity can reduce the hemoglobin A1C, but also triglycerides, blood pressure, and insulin resistance. So what are the benefits of resistance exercise? This type of exercise can improve the muscle mass, then body composition, strength, physical function, mental health, bone mineral density, insulin sensitivity, blood pressure, lipid profile, and cardiovascular health. So if you agree with me, the patients can achieve all this with a couple of drugs, not just with one drug. So the physical activity can do more than a couple of drugs for patients with diabetes. Why it is so? Because the aerobic exercise actually increases the muscle glucose uptake up to 5-fold through insulin independent mechanism. So after the exercise, glucose uptake remains elevated by insulin independent ways 2 hours, and insulin independent up to 2 days. So the time of insulin sensitivity is prolonged if the physical activity is regular. So improvement in insulin action may last for 24 hours if the physical activity is vigorous with a shorter duration of 20 minutes. So what will be the insulin sensitivity depends on the time and intensity of the physical activity. So the regular aerobic training can increase the muscle insulin sensitivity in individuals with pre-diabetes and type 2 diabetes in proportion to exercise volume and intensity. So what is the effect of physical activity on glycemic control? It is proven that it can improve hemoglobin A1C by 0.57%. And there is one meta-analysis of 12 trials in adults with type 2 diabetes, which shows that there is an even bigger reduction, up to 2% in HbA1c after the aerobic physical activity following with resistance training, but there was no difference in cardiovascular risk marker reduction. So for glycemic control, this combining of these two types of activity, it's even better than each of them performed alone. So adults with type 2 diabetes should ideally perform both of this physical activity for optimal glycemic control of their diabetes. Regarding the last two types of physical activity, flexibility and balance training, they are important for older adults. They cannot improve the metabolic control, but they can improve the balance in older people, and with that they can decrease the risk of falls and osteoporotic fractures in older patients with type 2 diabetes. What is the importance of physical activities was very well proven with diabetes prevention program. So it was 20 years ago, but upon this trial we are still making the recommendation for physical activity. This trial was then include more than 3,000 patients, and they were randomly assigned to lifestyle modification program, metformin, then on like a control on placebo and triglycerin. And what was this trial? It was able to show that those patients that were on lifestyle modification program, they were able to reduce the relative risk for developing type 2 diabetes up to 58% in comparison with those on metformin, that they reduced this risk just for 31%, which shows that the physical activity is doing better than metformin in preventing the onset of type 2 diabetes in person with pre-diabetes. Also, the Look Ahead trial was a very important trial where the patients with type 2 diabetes and higher risk of cardiovascular diseases were also assigned to lifestyle intervention with the main target to reduce their body weight for 7%. So it was done with modest dietary a reduction of calorie intake, but also with a physical activity of 175 minutes weekly, divided in a couple of sessions. So results were quite impressive, despite that there was no difference in cardiovascular events between the two groups. This trial really showed that these non-pharmacological measures for lifestyle changes were able to improve a lot of elements in patients' life, as you can see, starting for weight loss, for better cardiometabolic risk factors, then sleep apnea, and many other aspects like sexual dysfunction, less severe diabetic kidney disease, and so many others improvements. So it is shown that diet and exercise programs works. In this meta-analysis, which analyzed 53 studies, it was concluded that when we are comparing these lifestyle changes with standard care of patients with diabetes, we can see that these lifestyle changes can reduce the incidence of type 2 diabetes. They can decrease the body weight, then fasting plasma glucose level. They can improve many other cardiometabolic risk factors, but also it is very important to know that how the program is more intensive, then the achievement of this program are more beneficial for patients with diabetes. So what should be the level of effort in our patients? We are measuring the level of activity like absolute intensity and relative intensity. What it means, that absolute intensity, it means it expressed in so-called METs units. So 1 MET unit is equivalent to the resting metabolic rate of the energy expenditure while we are awake or sitting quietly. And the other, or the relative intensity, it is very specific for the person, or it is to individual level of fitness or physical condition. And for example, this is how can we measure this relative intensity is percentage of maximum heart rate or oxygen uptake, both of which are really sign of a fitness of each individual specific. So that's how we can explain to our patients very easily how can they adjust the physical activity according to their specific fitness. So first for moderate physical activity, which means 3 to 6 meds, or it's like a walking briskly, like walking in the yard. This is the physical with moderate, and vigorous is more than 6 meds where we are jogging or running or some similar activities. But it can be easily explained to patients how to judge the level of their physical activity, not to go more or less than it is necessary for the better outcome of this activity. They should measure their heart rate. So for a moderate physical activity, the heart rate must be 60 to 80% of the maximum heart rate, which can be easily be calculated when we are minus 21 minus the age of the patients. And that way we can explain the patients what should be his heart frequency when he is physically active. Or very simple also to take the so-called talk test. So the patients, when they have a moderate intensity of physical activity, they can talk, but they cannot sing. But if it's the vigorous physical activity, then everyone cannot say more than few words. So this is a very simple way how to prescribe the physical activity and its intensity to our patients. And finally, how long and how often? There is a different recommendations quite recently. This is from this year, 2022. It is a consensus statement for the American College of Sports Medicine. And it is for patients with type 2 diabetes, and a couple of tips for the patients, and mainly that they should have a physical activity which is moderate or high intensity for 4 to 5 days per week, which is quite similar with the ADA recommendations, which are also from this year, 2022. And these are recommendations first for children and adolescents with type 2 and type 1 diabetes. They can be active at least 60 minutes per day or more, and it should be moderate or vigorous intensity aerobic activity. For the rest of the population, the adults with type 2 diabetes, you well know this recommendation. This is 150 minutes at least, divided in a couple of sessions, with not more than 2 consecutive days without physical activity. It can be replaced with less time, but with more vigorous activity for those who are capable or in a better physical condition. Also, what is very important that in adults, especially with type 2 diabetes, they should decrease the amount of time spent in daily sedentary behavior. So they should interrupt prolonged sitting every 30 minutes for the blood glucose benefits. And of course, the last 2, flexibility training and balance training, are recommended for older people with type 2 diabetes 2 to 3 times daily, like yoga and Tai Chi, or just for the balance and for prevention of fractures in that age. So can I summarize my talk? The regular exercise may prevent or delay type 2 diabetes development. It can improve blood glucose control and reduce cardiovascular risk factors. The prolonged sittings must be interrupted in patients with type 2 diabetes. You know the recommendations that I've already mentioned, and which is for me the most important part, and that this prescription of physical activity can and should be recommended at the stage of pre-diabetes and early diabetes in primary care level in order to improve the outcome of disease in these patients with diabetes. So thank you for your attention.
Thank you, Professor Tatjana.